So, building on Dr. Mackey's introduction video that you watched just before this, I want to discuss what is pain in more of a definition perspective. So, throughout all of these videos on pain and pain management, you'll be seeing these different words. Some of them you've seen before, some of them are new, but all of them have a very specific definition associated with them. So we'll try to hit them within the individual lectures as well, but it's important that even before we get started, you spend some time focusing on these definitions and making sure you have a general understanding of each word. So we each have our own definitions of what we think pain is based on our own experience, and there are even more sayings about pain, specifically in athletics. So it's important that we do spend some time investigating our own preconceived notions and our own biases surrounding pain with regards to what we expect from our athletes and our patients with regards to their experiences with pain. If we have sustained significant injuries in our past, we might be much less tolerant of people that are experiencing significant pain for what might not have a lot of tissue damage. But we'll use the same definition as you've seen previously. The only thing I would really add to this is that pain is a process, right? And you go through the process of sensing the pain and experiencing the pain, and then your body also responds to the pain, right? So you have sensory, motor, and emotional components to the painful experience with that. And so, although the definition of pain may be widespread, it needs to include all of these different components to be thorough enough to be of use. So a few of those definitions that I want to hit right away now. First is going to be pain threshold. And this is the point where pain begins to be felt. Right, so this is when the sensations that we are receiving from the periphery gets interpreted in our body as pain. Pain tolerance then is the amount of painful stimuli that the patient is able to withstand for a period of time. So pain threshold is before we actually say we are in pain. Pain tolerance then is how long or how strong of pain we are able to withstand or just kind of deal with before we seek additional help or whatever it is that we're focusing on. At what point does pain stop what we are doing and require additional attention? Acute pain now is pain of recent and sudden onset. That makes sense with acute, right? And it's typically a high intensity localized at the site of injury. But when we get into acute pain, we're often thinking of pain with a identifiable cause. Whereas chronic pain now is going to be pain that persists beyond the normal time, so it goes on longer than is expected or has an unknown cause or origin. Lastly, persistent pain is acute pain. We know we have a specific condition there, but the symptom lasts longer and is part of that previous or treatable condition. So the important thing here is acute pain makes sense, but chronic pain, what we would normally term chronic pain for chronic injury, is what we're going to call persistent pain. which is, like if we have chronic swelling, we have swelling due to the injury that lasts longer than what we would suspect. And so that would be persistent pain. In chronic pain, it's going to be beyond the normal timeline for healing, right? And in that case, it becomes its own separate problem. So to assist in the complexity of pain, right, which is this unpleasant sensation with that, right, includes all the emotional components, we need another term to describe the physiological component to pain before it is sensed as pain. And so we call that nocioception, right? This is going to be the neural component of encoding and processing noxious stimuli, right, or painful stimuli. So until the stimuli gets encoded, processed, and then eventually interpreted by the brain, we're going to call it nocioception. And this becomes really important because if we can block pain from getting to the brain or change the interpretation of the brain, we're still going to have nocioception. We're still going to have the painful stimuli or noxious stimuli occurring, but it's not going to be sensed as pain. So we can use pain control by either reducing nocioception, eliminating the cause of the pain, or changing the interpretation of the nocioception so it is not interpreted as pain. So we'll see different ways to do that throughout these lessons. And we're going to try to make it more simple than it is in reality. This is very complicated with that, as is any sort of personal experience. But for this purpose, think of nocioception as pain before it gets interpreted by the brain, or the stimuli of pain, right? Until it gets interpreted by the brain, it can't be pain. And so that then brings us to the discussion of pain perception and different factors affecting pain perception. First and foremost there, right, pain sensation is the stimulus received by the nervous system, or nocioception, right? So this is nocioception and the stimuli there. Pain perception then is what we call pain, the conscious interpretation of painful stimulus that can be affected by all sorts of different things, right? And so a couple of terms to include with that is hyperalgesia, which is a heightened sensation or response to noxious stimuli, and we'll look at this a little bit more. But then we also have the stress-induced analgesia, right? And this is the idea that people can sometimes play through the pain, right after injury, but they aren't able to once, they're out of that situation, right? It's the idea that our body does have the ability to kind of shut down some pain in this fight or flight mechanisms, and we look at how we can manipulate those fight or flight mechanisms to reduce pain sensation and perception in future lessons. But just a few definitions here to get started, right? But at that same note, we know that there are all of these influences on pain. Past experiences, if somebody has had significant pain in the past, it makes future pain, right, not as scary, not as intolerable because they have a different way of interpreting it. Their expectations of pain, as far as how they expect things to hurt, if it hurts more or less than they expected, that's going to obviously greatly affect their pain perception. And then there are sociocultural and personality sorts of things as well. We'll talk at the end of this course about the athletic culture and expectations associated with that. And so we know that being an athlete, and trying to fit in has some effect on how pain is perceived. So we know that it is this complicated component, and I just want to list at least these 4. There are many more influences on pain perception. So as promised, I wanted to dive deeper into this hyperalgesia, right? And so this is when we have a normally painful stimuli is considered significantly more painful, right? So the idea here then is that we have something that does normally cause pain, but we perceive that pain to be much greater. And there's primary hyperalgesia and secondary hyperalgesia, depending on when it's occurring. We need to contrast that to hyperesthesia, which is where we have a normally non-painful stimuli that then becomes perceived as painful. So we have a stimulus, something else like light touch or warmth or whatever, that then becomes perceived as pain. Compared to in hyperalgesia, we have something that does normally cause pain, but it gets perceived as greater amounts of pain. And so we're just working our way through some of these definitions, trying to understand pain a little bit better for the sole purpose of then looking at how we can manipulate it in the future. As Dr. McKee said, pain does have a purpose. And so we need to understand what the role of pain is throughout the rehabilitation process so we can educate our patients on what sort of things to expect. As mentioned before, right, previous experience and expectations of pain play a large component of the patient's interpretation of that pain. And so if we can put the athletes at ease by helping them understand what sort of pain they are experiencing and that some of that pain is to be expected. Early on, we do expect some new severe pain. In the middle of rehabilitation, some soreness and maybe fatigue towards the end. And that is all normal. That will really help the athletes or patients understand their pain as part of their overall recovery. And during that education component as well, we should focus on the difference between benign pain and injury pain, right? This is something that education really does help with, right? We can't just call our patients wimps because they are dealing with something, but often it can be just benign pain, and with that, it can be viewed as a positive in light, this idea of generalized soreness, fatigue after a hard workout, not associated with different aspects, but it can also then be considered injury pain, where we have dull, generalized, short-lasting pain associated with working out or doing new activities that then gets interpreted as negative, chronic, or uncontrollable pain associated with that. And you can use some of these descriptions and characteristics, sharp, localized, right, occurs and persists after exertion versus, during activity, you might have some dull, generalized, or short-lasting pain. So helping our athletes understand the difference between benign pain and injury pain can help their confidence and motivation throughout the injury cycle.